Welcome to the Speaking of Kids podcast. Speaking of Kids is brought to you by Kids Centered, a multidisciplinary center for children with special needs in the Massachusetts Metro West area and beyond.
Welcome to Speaking of Kids. Today we're talking to Dr. Miles Mason-Derwin, one of the founders of Kids Centered and a pediatric neuropsychologist. Nice to speak with you today, Doctor.
Nice to speak with you too.
So are you, as a pediatric neuropsychologist, a PhD or an MD?
I'm a PhD. So MDs and PhDs are different. I often refer to myself as a fake doctor. It often makes kids feel more comfortable because they're not going to an actual doctor with needles and an examining table. MDs are different. Actually, MDs can, by law or by insurance regulations, give the same test that we give, but they typically don't. Sometimes a developmental pediatrician will do them because they do get training in that, and that's kind of a little bit of an overlapping expertise.
What is your specific educational background, your expertise? How do you go from kind of high school to being a pediatric neuropsychologist?
Yeah, so I took a little bit of a roundabout route. I don't want to date myself too much, but I started out as a French teacher in a high school, and I had really no interest in psychology, and I hadn't taken any psychology classes. But when I was teaching, it was in a boarding school, and it was a kind of conservative Catholic boarding school that didn't have a lot of learning support and a little bit of counseling support and a very, very caring staff. But when I realized when I was working with students is there was a fair amount of students that actually had learning challenges and psychological challenges, and I started to become very interested in that aspect and how it was affecting their learning and their social emotional functioning. So as much as I enjoyed teaching, I sort of became more interested in those psychological and learning dimensions and decided I wanted to go back to school for that. So my entry point was initially school psychology. So my PhD is in school psychology. And then as I trained and got more experience, I was drawn to the neuropsychological aspects of it. And so I respecialized during fellowship in neuropsychology.
And where did you have that fellowship?
That was, I did 1 year at the NYU School of Medicine in the epilepsy unit. And then my second year was at Harvard School of Medicine at the LEAP program, which is a learning and emotional assessment center. And that was, I've been out of fellowship for, I guess, 12 years, which seems like a blink of the eye, but is quite a long time now.
Great. So what is the point of getting a neuropsychological evaluation?
So broadly, I would say that what brings people to seek out a neuropsychological evaluation, or why providers refer children and adolescents and even young adults for neuropsychological evaluations, are when a child's development just really isn't going as expected. And this could be in numerous areas. If it's academic, they're not picking up reading skills or writing skills or learning math concepts as you would anticipate, like their peers. Or they could be having social problems. They could be having trouble socializing like other children, or they're having trouble reading social cues, or they're getting into conflicts. They're having trouble picking up play skills. It could be in the emotional area. So they could be struggling to manage their emotions. They feel they're presenting with anxiety or sadness, or they're having emotional outbursts. They're having trouble controlling their anger or some other type of emotional presentation. A lot that's been coming up lately after the pandemic, I think people have been reading about this. A lot of parents have come in with concerns about this, so attention and executive function skills. So difficulty paying attention, fidgetiness, restlessness, difficulty managing materials, keeping track of possessions. That's a little bit for older children. And adaptive skills. So difficulties with everyday living skills, packing their bags in the morning, packing their snack, picking up their room, taking a shower independently. So this adaptive skills can look different for different age ranges, but just general adaptive function. And there can be other things too. Sometimes parents just kind of feel that things aren't quite right and that their child is just not hitting their milestones like other kids they're seeing their age.
What is neuropsychological evaluation designed to do?
Yeah. So, what I would say a neuropsychological evaluation is intended to do is to tell you how your child, how their brain works. So, how does your child think? How do they learn? How do they manage their emotions? So, it's really designed to give you a comprehensive profile of their strengths and their vulnerabilities, and this should tell you what's impacting their behavior at home, at school, and social settings, and just really any context outside of the home as well. As we know, children do a lot of different extracurricular activities. You could see them with their relatives outside the home, and they may manifest with all different kinds of behaviors. And what's driving their behavior? It's really supposed to give you the why. A lot of times we're asking for why. Why am I seeing this behavior in my child? What is the cause of this? And what we're trying to do is to give you this full profile to help you understand the complex factors behind what's kind of making your child tick, and how do we give you this comprehensive, nuanced profile about your child.
How does a neuropsych evaluation work? Is it digital, pen and paper? Is it invasive?
So, no, not at all. Neuropsychological testing is, I think, very benign, but can be tiring for kids. So it is basically all paper and pencil tests. Sometimes there are a couple computerized tests, and there are a lot of hands-on tests and a lot of kind of verbal, just asking children questions. And it's designed to measure different areas of cognition or thinking. So, and then there are some academic tests typically, depending on the scope of the evaluation. And they're designed to measure different, what we call cognitive skills or different areas of thinking. So some of the tests would measure, for example, attention, how well you can attend, executive function skills. I could do an entire lecture on or podcast on executive function skills, so I'm not going to get deep into the weeds, but those have to do with things such as organization and planning skills, switching attention, transitioning between activities, language skills, reasoning abilities, memory and learning. So how well you can learn information and retrieve it later, visual spatial processing, your problem solving abilities, your fine motor skills, how quickly you can process information, academic skills, and social emotional skills. Those are hugely important. So a comprehensive neuropsych would look at all of these aspects of functioning. And really, we're just measuring them with paper and pencil tests and just verbal tests where I'm recording or the neuropsychologist is recording answers. Sometimes some evaluators use iPads in part of that testing. Sometimes people are just using manuals and clapboards where you're flipping pages. But it's just one-on-one with an evaluator. And that's essentially what the testing kind of looks like, the nuts and bolts of the testing. One thing I think it's really important to highlight is there are a lot of people out there that are starting to do sort of computerized testing. Well, they'll say we're going to do some computerized testing. Where your child just kind of goes into a room for a half an hour, 45 minutes, and we're going to do a series of computerized testing, and we're just going to interpret those computerized tests. A neuropsych, in the traditional way it is done, is that an evaluator spends a significant amount of time with your child and is doing these tests and really looking at how your child's approach to the test, how they are completing it, and really paying attention to the behavioral observations to see how is your child, what does your child look like, and what is it like for them to do these tests, because that's really, really important information. And I'm going to circle back to that. So it's not just about the test score they get, but what was it like to be in the room with your child? Were they stressed out? Was it very effortful for them to do it? Were they very impulsive? That's really important information to get at their cognitive strengths and weaknesses and their learning style and how to support them. So it's not just the result and the test score, it's the process. And I think that's one of the most important things you get from a neuropsychological evaluation if you're doing it in a very careful and thoughtful way.
Is an evaluation self-contained or does it include outside information?
Oh, that's a great question. So every evaluation, before you even begin, you ask for a lot of paper. It's very annoying for parents, I'm sure. You ask for a ton of paperwork from parents. So you ask for what we call a developmental history. So where we ask for information from birth up until the present, all about the child's development. We ask for teacher forms to get teacher input, and we ask them to fill out a series of questionnaires so that we have all of this background information about the child. And that's hugely important because we have to know everything about the context of the child, not just how they present on the testing day. That factors in greatly into how we interpret the data. Because the child exists in this context. We have to know about the child's development up until the day of the testing to understand how they're performing. Do they have a history? Did they have early birth and developmental issues that we have to take into consideration? Do they have a significant history of anxiety? Do I have to anticipate that anxiety is a factor? So that is that, and that has to be also reflected in the resulting report. We have to think about other factors like stressors. So has a family gone through a divorce? Has there been loss? Are there siblings? How are the sibling relationships? So all of that information, children develop in a context. We have to know everything about that context to really understand that child. And that also has to be taken into how we interpret the data.
Are you also looking at the batteries of tests that schools do?
Yes. This is a little complicated. Sometimes before students come to the office, they have been assessed by their school. And when that happens, we have to really carefully look at that data. I don't want to get into that now because it's a little complicated, but I can get to it at the end and circle back. But if the child has been tested before or is getting services through the school, sometimes, for example, through an IEP or an individualized educational program, it's really important for us to look at all that data and to look at the services they're receiving. We want to make sure that the category that they're receiving the services through, which would be something like perhaps a reading disability or an ADHD diagnosis, is appropriate and that they're getting the right services. That's often also a question why parents come to us. They say, well, he or she are getting services in school. We're not sure if they're effective. We're not sure if they're appropriate. We're unclear about their diagnoses. So sometimes that's also a reason that parents approach us for a neuropsych. And there are some other considerations that if the school has done the evaluation, we have to evaluate using different measures. And we want to think carefully about answering their questions, because their questions might be a little bit different.
So a neuropsych is not meant to replace that school testing.
No, absolutely not. It's a little bit different. When I get in a little bit deeper into the interpretation, I can explain how they are different. School testing is really valuable and gives a lot of information, but it's slightly different than neuropsychological testing. Typically, they don't give as many tests and they don't assess as many domains and they don't integrate information quite the same way. Having been trained as a school psychologist, that process is really important. It's really important to children's functioning. It's really important that school teams have great information that they come together and think about children in an important way. As a neuropsychologist that often works with school teams, I think neuropsychologists can provide good information to school teams and collaborate with them to make their programming stronger and have a really good collaborative relationship with school teams. But it's slightly different.
Who sees the evaluations once you've completed them? Who's the audience for the evaluation?
There's many different audiences. So the first audience is the parents, right? So we do all the testing And we write a comprehensive report that explains how the child's thinking style. It explains how the child processes information. What does the child do really well? The child may have really good strengths in their language processing skills. They may have a great memory, but they may struggle with nonverbal processing. They may struggle with mathematical concepts. Conversely, a child may have really great abstract reasoning, really good problem solving, but they may have dyslexia and they may have a lot of difficulty with language processing, with reading, and they may have attentional issues. So there may be diagnoses in the report. So for example, there may be a dyslexia diagnosis, there may be an ADHD diagnosis. Part of the purpose of the report is diagnosis, if a diagnosis is appropriate. So that's important to label a learning difference or an emotional difference, if in fact that's appropriate. But the way I think about it is that a diagnosis is only helpful in that it can help me tell something to an audience about a child. That diagnosis should inform intervention. So it should be able to tell me, how can I help this child? If my report just says, this child has ADHD, great, that doesn't help me. The diagnosis should help inform what we're going to do for this child, and it should give everybody information about the child. So the diagnosis is just the entry point to say, what are we going to do for this child? Help me understand this child. So the report should, if there are diagnoses, then it should have diagnoses, but the summary should explain how the child learns and thinks.
So you're not just dropping a bunch of test results in a parent's lap and saying, okay, well, here are all the numbers for your kid.
Correct. So the way that it works is when you give these tests, you end up with a lot of different data points. And that's a lot of what we call quantitative data because it's numbers. And you're giving tests and you're saying, how does this child do compared to peers their same age? And you may get a score in the average range. That means they're developing like their peers, or it may be below, indicating it's an area of weakness, or it could be above, meaning it's an area of strength. And so you want to look at that, and then you want to say, okay, this is the profile. But you also want to think about things carefully. Something may fall in the average range, but when you look at the child's approach to it, it may not be quote unquote average, because say the child, for example, did a math test and they got an average score on a calculation test, but it took them 45 minutes to do it. Okay, so they do have some good skills, but for them to retrieve and demonstrate those skills was incredibly painful and effortful. So we want to document that and say, what is going on here? We need to help that child. We need to see if this is anxiety, if this is a very slow processing rate. We want to look at their processing rate across other measures just to see if they have very slow processing and how long, and if they need accommodation or if there's an accompanying disability or disorder that goes along with this. So it's also about their approach to the task and what it's like to be in the room with a child. A child may get average scores, but they may be literally rolling around on the floor because they're having trouble attending while they're doing something. I've had children like that. They've got very high IQ and very strong cognition, but they're so inattentive, they really can't sit still. That's very, very important to know. So we really have to think about, what does this child look like? What do they need? Not what was the end result and what was the score, but what was the process? And we want to integrate that quantitative data with the qualitative, what did that child look like? When we're looking at the data, neuropsychologists had specific training in understanding what we call brain behavior relationships.
So why do children have different learning profiles? I mean, where does it come from? Is it learned? Is it something they're born with?
Yes, so that's a great question. One of the things that I think it's really important to say as a neuropsychologist, and I think there's a little bit of confusion about this, is that neuropsychologists have specific training that allows them to call themselves neuropsychologists. They study what's called brain behavior relationship. So they study the neuroanatomy of the brain that helps them understand relationships between different functions and neuroanatomical structures in the brain and behavior that we demonstrate. And so when I was talking about different functions, such as attention and executive function, visual spatial skills, language skills, there are different neuroanatomical structures and different circuitry in the brain that are associated with these skills. And neuropsychologists get special training on fellowship to explicitly understand these relationships, understand the measurements, the assessments that are used to assess these skills and how to interpret the test. And I really just want to stress this for a moment. Just as I was saying that an MD can administer these tests, really anybody with like a master's degree can administer these tests, but it doesn't mean they've gotten specific training in how to do it. So a lot of times you'll see a report that they'll call a quote unquote neuropsychological evaluation, but it doesn't mean that somebody with extensive training in neuropsychology has actually administered and interpreted the test. So I just would caution you all that when you're looking for a neuropsychologist to do the testing is that you do a little investigating of what their actual training is. Do they have a PhD? Did they do a 2-year fellowship in neuropsychology? Because there really isn't a lot of regulation around this. And it's really important because you're looking for someone that understands these brain behavior relationships to say, what we want to know, why is my child acting this way? Well, okay, or what's driving their behavior? We are looking at these brain behavior relationships. What are the neuroanatomical structures and the relationships to the cognitive tests and the performances on these tests that we're seeing? How do we correlate them? How do we understand their behavior? The neuropsychologist got very specific training to understand this and understand the neurocognitive structures and understand the domains, which means the attention, executive function domains, the visual spatial functioning domains, to say these are what this entails, and this is how this is going to affect behavior. This is what this is going to look like in every day. And so there's a lot of information that neuropsychological evaluators, neuropsychologists gained through that training that other providers did not necessarily gain. And we're using that to interpret profiles to understand how children process information, how they learn, and what they need to be successful.
When parents get these reports, I mean, how big is a report? You've gone through so many different ways that you test kids and so much different information you look at. I don't imagine they get like a 1-page PDF in an email.
Mm-hmm, mm-hmm. So they can be different lengths. And sometimes this also depends on where you live in the country. If you're in a hospital or private practice. So sometimes they can be quite lengthy. In other settings, they can be briefer. So in New England, they tend to be a bit longer. One of the things I think that's most important, and depending, I would say that I'm going to focus on the content rather than the length. The things that are most important that you see in a neuropsychological report is that you have a really solid history that's explaining the child's journey up until the neuropsychological evaluation, that you know what's the background, because that background is going to be very important. If we don't know what the child's journey is up till now, we won't have any context for the child. Secondarily, the summary and the impressions. How did the neuropsychologist integrate all of this information, their understanding of brain behavior relationships, their understanding of the test material, and the behavioral observations? How did they integrate all this information to understand this child? So they took that quantitative data and they're looking at language skills and attention and executive function and social emotional functioning and the academic data. And they integrated this all to say, this is how this child learns. This is how they're processing information. So every child has cognitive strengths. They all have and personal strengths, and we want to highlight those. We want to see where the vulnerabilities are, and we want to say, okay, what do we know? How do we explain to teachers, to parents, to other audiences, what will this child do well? How do we highlight what this child will do well? How do we say, here are some strategies that will make this child successful? And how do we support their vulnerabilities? How do we help strengthen the vulnerabilities? And then also kind of recognize, well, maybe these will always be vulnerabilities, and how do we provide some strategies to kind of work around them and acknowledge them? So that's really some of the main focuses of what we want to do with a neuropsychological evaluation. And we want to make sure that piece is comprehensive. We want to make sure that we're giving a really comprehensive summary that multiple audiences can look at and say, I got this child. And I didn't just get a mechanical summary of, his language skills fell in the average range. His visual spatial skills are below average. His academics are okay. Well, that didn't really tell me who this child was. You want to feel like after you read a neuropsychological evaluation that you were in the room with this child and you understand how they think. And then you want to know, what do we do next?
Which brings up a good point. When the parents get that report, what do they do with it?
Yeah. So good question. The first people who get the report are the parents. And so a big purpose of the report is for the parents to better understand their child and read about their child. And there'll be recommendations always for parents for things to do in the home. Perhaps, strategies for how to function better in the home. And then strategies maybe for things to seek privately if the child's in distress, perhaps psychotherapy, if they have fine motor issues, occupational therapy. I'm just throwing out some random recommendations that may be in there. But also typically there are going to be things that are recommended for the school. And it's always helpful to send the report to the pediatrician, who I kind of think sometimes is like a quarterback, because they're always there with continuum of care. So you want to give it to any provider who's really consistently involved in the child's life. If they already have a therapist, if they have any type of other provider like a speech language pathologist or an occupational therapist, you want all those providers to have that information to help them understand the child and to help them, again, with what I would call continuum of care, so that all the providers are on the same page and have and can coordinate by having additional information about the child. Children spend almost all their time in school. That's the major focus of their life. So what I think is that it's really important for a school to have the report, to have the report. So some students have a high level of need in school. And that part is hugely important because they're getting really extensive services in the school. I may be recommending a total change in placement for this child because they have very extensive needs, or I may be recommending just some accommodations that they may be informal accommodations. But either way, I think helping teachers and other school team providers just understand how the child thinks and getting a better understanding of the child is really important. So I'd always recommend that the family share it with the school. And sometimes I think that does make parents nervous because it's sensitive information. It's information about your child and it is being shared with the school. So I know that that's hard sometimes, and I do have those conversations with families. So I think that's everybody I would say that would share the report. The other thing I would say is the recommendations really should be your roadmap as to what you should do next. The recommendations are that we write at Kid Centered, the providers we have at Kid Centered, myself and the other neuropsychologists, they're very extensive. They're very personalized. They're very personalized to the child. And they go through every area of their life. So what should we do at school? What should we do at home? What should we do in an extracurricular, perhaps? It's very specialized to the child because we want to know what to do next. Parents are coming with questions about them, and often they're saying, "I don't know what to do. I'm confused," and they always want to know, how do we help? So I always think of that recommendation section as here are all of our suggestions as to how to move forward and help the child. I kind of think of a neuropsych as not a living document, but it's not just here's what you do for tomorrow. It may have recommendations that you're not going to implement for 6 months or a year because it's an extensive document. So it might be something you refer to back over time. There may be interventions that you won't be able to enact for a while. It should be a pretty extensive roadmap of a range of services and a range of supports that your child could benefit for to help maximize how they're functioning.
And how young should a student be before you give a neuropsych, or what's the ideal range?
Yeah, so I wouldn't say there's an ideal range. Typically, for myself, I see starting at 5 and I go to young adult, kind of 22, 23 transition age. We at our center, we do have kids. We do have neuropsychologists that see young children. So more like 3 and 4-year-olds. Neuropsych, I would call when you have 3 or 4-year-olds, I would call that more of a neurodevelopmental evaluation rather than a full neuropsych evaluation. Often the referral questions when they're that young are different. Sometimes they center around autism or just you're lagging behind in development in general. Those can be very important evaluations. The focus is very different. I don't think there's any ideal age. It's really, there should be a really relevant concern that's driving. We're having a problem. We're having some difficulty and we really want this question answered. We think it's a good time to answer a question. There seems to be a struggle.
You kind of bring up a couple of good points when you talk about age range. So if a child is younger and a parent is seeing them challenged in ways in school and they get a neuropsych, does that kind of set them up for the rest of their lives? And is that the blueprint for their ongoing education? And you also talk about seeing people in their young adult years, in their 18 to 20 years. So what's the difference between getting a neuropsych when you're, say, 7 compared to when you're 17? And also, when you talk about schools and young adults, are you saying that neuropsych can also help, say, kids entering college?
Yeah, so all really important things. So the first thing is some kids, there's no set path. It really is dependent on the child. Some children have more complex profiles and more complex levels of need, and often they will get reevaluated on a more consistent basis. Within schools, if you're on an individualized educational plan or program, they kind of quote unquote expire every 3 years, and you have to go through what's called a triennial to see if you continue to qualify for services. So a lot of times, if there's a child that has ongoing significant challenges, often they choose to reevaluate every 3 years. If a child also is very medically complex, for example, if they have epilepsy, if they have a complex condition, you may want to reevaluate at a more regular interval because you may have concerns about cognitive decline or cognitive changes. You may want to reevaluate more frequently on a 3-year interval if there's significant learning disabilities and you want to make sure they're keeping pace with progress. Sometimes I work with parents. They want an independent outside eval to make sure to have their own data to see if their child's keeping up and to compare with school data. We have people like that who come to our center. The other thing is someone may just have some questions and come once and then we're sad not to see them again, but we're very happy that questions have been answered and they just needed a one-time eval and they really don't need anything else. They're doing well. They needed some support and some clarification and some intervention, and then they're on their way. So it can really depend. I never standardly recommend that a child needs to be evaluated every 3 years and you have to come back for monitoring. That's certainly not the case. For college level, there also are different paths. There are students who've had longstanding learning challenges that do need to come back because they need additional accommodations. So they need ongoing accommodations. So they need to kind of get reevaluated in their senior year to make sure that they can qualify for accommodations when they go to college. The other thing is we do see a fair amount of college-age students that have kind of had mild struggles or have had struggles, but were manageable through, through their education, and then things were kind of falling apart in college. And that could be academically, but sometimes it's socially. Sometimes their adaptive functioning kind of falls apart. They can't get to class on time. They can't do their laundry. It's just that independent functioning. So they kind of finally are blowing the whistle on, things are just not working. So that's something that happens in young adulthood too. I think a trend right now is some young adults wondering if they have autism. That's often a question, as they kind of say, well, I kind of always felt a little bit off socially. I was able to get through. It's really bothering me. So there's kind of a range of questions for transition. Not, I guess it's a little bit older than transition age, college age. And then we do have students that have a higher level of need that are that age and need ongoing evaluation. And we do transition planning as well for them.
You've mentioned various ranges of challenges that kids have. And so I have two questions. One is that you don't need a diagnosis going into this, that the neuropsychologist is the one who gives the diagnosis. And I'd like to know a little bit about what are the kinds of diagnoses you see or give for the students that you see.
Yeah, so a range of diagnoses. I would say that neurodevelopmental disorders, and a neurodevelopmental disorder could be ADHD, autism, learning disabilities, dyslexia, math disorders, writing disorders. Sometimes those are called dysgraphia. Math disorders are sometimes called dyscalculia. A developmental coordination disorder. So anything related to learning, anything related to attentional and executive function skills, anything related to autism and social communication challenges, anything related to psychiatric challenges. Anxiety, depression, mood disorders. We've seen psychosis, psychotic patients, OCD. Our clinicians were trained both with medically complex populations and also with a wide swath of neurodevelopmental and learning-based issues. So we really have see the gamut. I wanted to go back to one thing that I think is important. I like to call what we do at Kids Centered is developmental management, is that we see children over time. The one thing I loved hospital training. I think what hospitals do is amazing and so important, but you often don't get to follow patients over time a lot. One thing I love private practice is patients come back to you. And I always say to a patient, if something's not working, just come back. Come back in 2 months, come back next week, come back whenever you want. You don't have to wait 3 years. If something is not working, let's figure it out. And we can do a consultation. We can do a little bit of testing. We can just try to figure out what might be going wrong. And the thing about students is their cognitive profiles can change too. So they're in development, and how they develop can also change based on the interventions they receive. So that's really important to note, that what I see in a child when they're 8, it may stay stable over time, but in fact, it can change. And that does sometimes happen. There's no set path that your cognitive profile when you're 8 will look just exactly the same as when you're 12 or 15, especially with interventions.
So the testing sounds pretty intense, especially when you're getting into kids with greater challenges. How long does one of these testing sessions, or how many sessions does it take to test a child as thoroughly as you do?
I would say that typically sessions take about 4 to 6 hours, depending on the age of the child and the scope. Depending on the child's attention span and what I would call their task persistence and their frustration tolerance and their level of anxiety, we may split that up, because you don't want to test. If somebody's exhausted, I don't want to keep testing them, because you're not really testing their ability, you're testing their fatigue. If somebody's super anxious, I don't want to keep testing them. I want to break that up and try to make them as comfortable as possible. The same thing with if their distress tolerance is very low and their frustration is very high, and they're not tolerating the testing very well, the results are not going to be particularly valid. So we want to try to accommodate those those pieces as best we can. Sometimes they'll break up the testing into, I've broken it up into as much as 3 or 4 sessions. And sometimes you can just go through a day and be fine. Those college students usually want to get in and out of there. So it really depends. But that's typically the length, and then they can be broken up as you need them to be.
So for parents who have noticed that their child is having some challenges and are thinking about this, where can they find a neuropsychologist?
So that's a good question. You can go to your pediatrician for referrals. Googling sometimes helps. So I would recommend talking to other parents, actually, because often when I get referrals in, I'll say, how did you find us? And they'll say, my neighbor or my roommate, or not my roommate, sorry, my next door neighbor or my good friend down the street or something. So I think discussing it with other parents, if your child has a therapist, therapists typically have some referrals. If you have an educational advocate, advocates typically have a list of neuropsychologists that they refer to. Large hospital settings all typically have neuropsychology departments. Just be aware that you're going to have a very long waiting list. So you can put your name in there. It just will have a long lead time.
What is one takeaway that you think parents should consider when they're looking at whether or not they should get a neuropsychological evaluation for their student?
I think that parents, after they do it, they are perhaps surprised, or the thing I hear the most is that they learned a lot about their child, and they feel like they're better equipped to understand them and to advocate for what they need. So that is probably the thing I hear the most. They understand what they're going through. I think they're able to have more empathy for them, and they're able to understand what's challenging for them, and what they're trying to overcome, and what their day-to-day is like. If the child's having more difficulty and you're needing to advocate, it arms the parent with very concrete information to help advocate for the child. So you have more data, more support to say they need more help. This data is showing they didn't make progress, or they need this, or they need X or Y. If you are in a situation where your child's really struggling and they're not being supported. But I think holistically, that's probably the biggest thing I've heard is, I understand them better. I know better now how to approach things, or I know better now what to do.
Well, thank you, Dr. Miles Mason-Derwin. This has been extremely informative. I think parents will get a lot out of this as they are seeing their child struggling or wanting to know why their child is having the challenges that they do. And thank you so much for taking time out of your very busy schedule. And hopefully we'll talk to you again soon.
Sounds good. Thank you. Please visit our website at kidcenter.net. Look out for our next podcast wherever you get your podcasts. Upcoming podcasts are about IEPs, 504 plans, language-based programs, and more. Have a great afternoon.